Hello. Good morning. We'll be live in about 3 minutes at 11 a.m. So, yeah, let me see if everything's looking fine. I hope it does. Good morning. Welcome. Good morning. Welcome to DentalDost YouTube channel. Good morning. How's everything looking? It's 10:58 right now. We'll be starting at 11 a.m. So let's wait for a few minutes for everybody to join in. Good morning. Hello. I can see a few participants coming in. Let's wait a little bit. We'll start at 11 a.m. Hello. Good morning. Good morning, everybody. Welcome to the YouTube channel of DentalDost. Good morning. What time is it right now? Okay, just 1 minute to go. Good morning. Hello. Good morning, everybody. I can see a few more participants coming in. That's good. We'll start at 11 a.m. Good morning. Is it time? No, we have a little bit. Let's wait for more participants to join in. Good morning. Hello. Okay. Hello, good morning, everybody. Welcome to DentalDost YouTube channel. I hope you had a nice morning so far. Welcome back to our channel today. So, hope you're enjoying all your festive days as much as we enjoy solving your dental queries. This is the part 2 of our Diwali special video, which is based on all the in-office dental treatments that are available for you to brighten up your smile for this Diwali. So let's get started. My name is Dr. Asavri Sawant. I am a dentist and a master's in public health from the UK. And today, for DentalDost team, I'll be taking this webinar on all the in-office treatments available for you to glam up your smile for this Diwali. In this webinar, we will be talking about all the facial aesthetics and procedures, everything related to cleaning, whitening, and shining up your teeth for Diwali, and also about a few fun topics such as tooth jewelry and everything else. So let's start with the first one. I have so many patients asking me that what to do when they have yellow teeth. So if you have a problem of yellow teeth, it could be due to two reasons. One, that is because of the deposition of plaque on the surface of your teeth, or it could be due to the dentine erosion of the top layer of your teeth, which is enamel, and the inner brown dentine layer showing reflecting through. So for the first reason, if you have a problem of plaque depositing on your teeth, you can go for a few treatments such as teeth cleaning, or we also call it scaling. What it does is the dentist removes the debris or plaque that is deposited on the surface of your teeth effectively with a tool in the office, and which gives you brighter and cleaner looking teeth overall. It will also help you if you have a problem of bleeding gums, because it could be due to underlying periodontal reasons. So that is that. If you want If you feel that your teeth are clean enough but still aren't as shiny, you can go for another treatment which is called teeth polishing. So the dentist would polish your teeth on all surfaces, making your teeth glow brighter and more shiny. So that will make a good appearance on your face. If you are having the second problem of dentine layer reflecting through, you could go for treatments such as teeth bleaching or teeth whitening. There are many options available for this one. You could go for at-home dental whitening kits that are available now as well. But the best would be to consult your dentist and go for a full-fledged dental bleaching treatment in office. That will give you the most results. Um, the time span and the lifespan of teeth cleaning and all these procedures depend on case to case basis, but usually dentists say that one cleaning in a year would be sufficient for you to have a glamorous bright smile all throughout the year. So yeah, but it still depends on case to case basis. Now if you have this other problem that you are feeling sensitivity or something like that, it's best to consult your dentist first before trying anything on your own. So he would be able to tell you what is best for you and what else you can go for to glam up your smile. So these were all the cleaning and whitening and those sorts of procedures that we have. What results can you expect? With scaling, you can instantly see your teeth more clean and brighter looking. With polishing, you will see that your teeth are shiny, they reflect light more, which makes them more appealing for pictures and videos and everything like that. Even in day to day life, they would look more shiny and bright. If your teeth are really yellow and because of any habits such as tobacco or smoking or anything like that, you should first try to quit that habit. And when are successful in quitting that habit, then you can go for procedures such as I mentioned, scaling or teeth whitening or teeth bleaching. That would help to a great extent depending on the severity of the yellowing in your teeth. If you have any other problems such as pink tooth, what pink tooth is accidentally when you face a trauma and when you fall into an accident, you accidentally chip your tooth, or the upper layer of your tooth falls off due to a fight or an accident or anything like that, and the inner blood shows through, that is called either chipped tooth or pink tooth. What you can do for those reasons is go for some other treatments, such as you can go for a simple composite filling if that is possible in your case. If the tooth can be restored with a simple filling, composite filling, that is well and good. If the inner pulp is showing through, if you are having blood from that tooth, or severe sensitivity, or half of your tooth is chipped off, then you need to go for some other treatments, such as you would need to go for root canal treatment, or or different sorts of procedures such as teeth veneers, teeth bonding, or something like that, that we will discuss coming up. So that is that. For all these reasons, for pink tooth and stuff, you can see celebrities have perfect tooth all the time. How do they have these perfect teeth all the time? And what do they do? It's because dental veneers are their heroes. What it does is dental veneers are stick on thin plates that you can stick on teeth at a dentist office, and they not only help with teeth having abrasion, but they also help in getting that celebrity teeth, celebrity like smile that you see everywhere. They are also called as Hollywood teeth at some local terms, and they are very good solutions when you want to have those sort of perfect looking teeth for any special occasions coming up, for say Diwali or your wedding or a special event or a performance or a photo shoot or anything like that. So they are good. They stick on only on enamel, and they are very thin shells of teeth. So if you have just as you have stick on nail paints, they are like stick on teeth that you can get them at dentist office. But they, it depends on what case you are going for. Dental veneers aren't possible on every case out there. It really depends on the case to case basis, and your dentist would be the best person to tell you if it is suitable at your case or not after checking your oral cavity. So that is about dental veneers. Now, uh, if you have deeper stains or very sensitive teeth, it is not usually recommended in those cases. You are usually not recommended to go for dental veneers if you are suffering for very sensitive teeth, because you have to take precautions as well. When you eat or bite into something, you need to cut it first. If you're eating an apple, you need to cut it into pieces with a knife, then eat it. You won't be able to roughly use your teeth when you have veneers on. So those are sensitive like that. But it really depends on what sort of occasion we are going them for. One procedure easily lasts up around easily for around 8 months to 1 year or so, depending on your case. Your dentist will be able to tell you more about that. If As we discussed, if you have a bigger problem of like misshaped teeth, mal-aligned teeth, or any case in which you would want to change the shape of your few teeth or all your teeth or something like that, you could go for one would be orthodontic treatment. But it takes time, and if you want results quickly, and you are not ready for the orthodontic treatment, then you can also go for treatments such as teeth bonding or dental crowns. What is does is that also helps in changing the shape of your teeth to some extent, depending on your case. For then orthodontic treatment would be the permanent and best solution that dentists would recommend if you have a problem of mal-aligned or differently shaped aligned teeth. There are various types of orthodontic procedures available. There are simple braces, wired ones that you can go for. But if you have that sort of problem where you are a public figure or something and you cannot go out with braces, you can also go for clear aligners. They are very common these days, and most of the dentists will, orthodontist would guide you more on them. They are basically a clear tray of shaped with your teeth, and you set it on your top and bottom teeth when you're not eating or chewing, and it helps to bring your teeth to proper shape, to their proper places. And it takes the similar sort of time as it would for a normal orthodontic treatment to bring all your teeth to their place, and that would give you a better looking smile. And You could also go for dental crowns, depending on what case and if it is possible. If you are having problem of spacing between teeth, which is we also call midline diastema if you have spaces between all your teeth, some of your teeth or the front of your teeth, what you can go for is go for bonding, veneers, or any of the procedures I mentioned above. Your dentist would be best to guide you more on your specific case, but uh, it can be easily corrected through building up composite on either side of the space so as to close the space to normal available space. So that is one option that would help you enhancing your smile, especially for Diwali. That procedure of closing the space of midline diastema using dental bonding and stuff doesn't take much at all. It doesn't take much time. One procedure would easily be able to, the dentist would easily be able to tell you more on it, and the complete procedure would not take more than 2 hours or so of your time. So you can go for that sort of procedure if you want a quick fix, and that doesn't take much time. If you're concerned about facial aesthetics and all the procedures for beautifying your smile overall, not just your teeth, but your overall smile, what you can do is, I can tell you all the different facial aesthetic procedures that are there. There is one procedure if you have problem for pigmentation in your lips, if you are feeling your lips are too dark, if you want a brighter looking lips or the color of your lips are dark, you can go for depigmentation of your lips. But if the reason for your dark lips is underlying habits such as smoking, you should first try and quit that smoking habit. So once you have successfully achieved quitting that habit, after that you can go for depigmentation of lips procedure, which is usually carried out through lasers. It is not just the dermatologists who do these procedures. Dentists also, those who are specialized in these procedures, are able to perform these successfully. So you can consult a specialist dentist who specializes in lasers and facial aesthetics. He will be able to guide you exactly on the duration and the number of sittings that would be required for depigmentation of your lips and everything around it. So specialist dentists are there and you can reach out to them for these reasons. If you have another problem of darkening of your lips from the side, it could just on the corners of your mouth, it could be due to problems such as angular cheilitis. You need to look more into, you need to consult a physician or a dermatologist or a specialist dentist for this problem. It may be due to various different reasons. It could be due to nutritional deficiencies, it could be due to some infection, it could also be due to some trauma that you've faced around that region. Could be any of the three or more. So please consult your dentist who is specialized in facial aesthetics for this reason, or you could also consult a dermatologist for angular cheilitis or any of those reasons. A skin specialist would be able to consult you as well. If you have problems of, if you want a cheek lift or a Botox, or if you want to get rid of the wrinkles around your lips or upper lip or those areas, there are treatments out there in facial aesthetics which specialized dentists can do, which is called thread lifting. It helps in tightening of the skin around your lips, which helps in giving a younger, more youthful smile. This procedure is very common amongst people who are in their mid-30s or even younger and are facing that sort of lip sagging, lip wrinkling problem. So you could go for those procedures. Any dentist who is certified in facial aesthetics would be able to tell you exactly about the treatment, if it is suitable in your case, and what sort of results you would be able to achieve from that treatment. So that is out there. If you want, if you have a problem of dental cavity or caries or anything, and you want your teeth to look similarly exactly as the other teeth, there are many dental filling procedures such as inlays, onlays, etc., in which they make the part of the tooth that is missing, they make it in a lab and they stick it on, so you uh, aren't able to identify if it looks just as new. Other fillings such as crowns, composite fillings, and everything are available. They are tooth colored fillings, so you won't be able to tell if you had a decayed or a carious tooth before. It's a relatively simple procedure. It doesn't take, that filling doesn't take much time either. So you can consult your dentist for details on that. He would be able to tell you which procedure you could go for. So, how much time do we have? Okay, so we'll take all the questions that we get in the last 10 minutes of the video. Now, let's talk about some fun stuff, which is tooth jewelry. I get many people asking me this question that, do you recommend tooth jewelry? Would you as a dentist recommend tooth jewelry? And what is it? And can we go for it? So what tooth jewelry is basically gemstones and diamonds, which dentists can stick on your teeth in accordance to the angle of your smile and your face, when the light reflects on your teeth and your face and you smile, the portion that shines the brightest, you can have a diamond or a gemstone over there to enhance that sparkle. So it gives you that sparkle in your teeth. But personally, as a dentist, I wouldn't recommend you to go for that. I would not, because it is a sensitive procedure. You need to take care of the gemstone in your mouth continuously. You have to have a good oral hygiene routine for mornings and evenings. And you need to take care that accidentally you do not swallow that gemstone by accident or something like that. So I wouldn't personally recommend. But if you are into film profession, or media, and you are a celebrity or and something like that, celebrities do go for these procedures for tooth jewelry, tooth diamonds, tooth piercings as well. They are also out there. And they stick on to any part of your teeth that you want. They are very famous outside India and in India as well. Teeth grills, teeth light, gold, or rose gold teeth are also up in the range these days, but they are very difficult to maintain and not a very common procedure for if you are like you and me. For everyday life. So I wouldn't recommend those, but they are also out there. So let me just quickly talk about DentalDost, what DentalDost is and what we do over here. DentalDost is a team of oral wellness experts backed up by a group of tech technocrats. At DentalDost, we are dedicated to changing and improving the oral healthcare ecosystem in India from a 360-degree perspective. We have India's first ever dental helpline, which is 7797555577. Let me repeat it. It's 7797555577. This helpline is India's first ever dental helpline. This is completely free and is available 24/7 for you to connect patients directly to our super qualified dental experts. The person you'll be talking to on the other end of this helpline is a dental expert from our team, and they will be available 24/7 for any of your oral emergencies or giving you a free oral diagnosis. Helpline, patients can get instant consultations along with diagnosis and solutions for their oral issues. Feel free to call the helpline number for free dental consultation from any part of the world. It will be in the description box below. So we have a large network of qualified dentists, qualified DentalDost approved dentists all over Pune who treat our patients at reasonable prices and are located in every area closest to the patient. And we soon will also be launching our AL powered app, which helps you to scan your teeth and get your oral diagnosis within seconds. Now let's get on to some questions that we have. Okay, we have 8 minutes. Good. So I got this question, that is scaling very painful? No, scaling is not a painful procedure for normal if you have a normal oral cavity. If you are suffering from diseases such as periodontitis or extreme bleeding from your gums, you may face a little sensitivity, but scaling helps in these problems wherein it gets rid of the debris and plaque deposited between the gums and your teeth, so that helps in healing of your gums faster. So it is not a painful procedure. It is a pretty easy and common procedure for dentists to perform, and you can get scaling done. Dentists recommend to get a scaling treatment done once in a year, which would give you healthy gums and good looking teeth for year long. So that is that. How can I get tooth diamond done? Okay, so if you want to get a tooth diamond done, first the dentist would need to check your oral hygiene. What is the level of your oral hygiene that you are maintaining? If you are brushing well, if there is no plaque or debris deposited in your teeth, if everything sounds good, then you could go for that. How it is carried out is the dentist measures the angle where the light falls on your face and on your teeth when you smile to a camera. On that angle, they either drill it and then stick on the diamond with composite, or sometimes they do not need to drill it, they just simply stick it on. So it depends from dentist to dentist and from case to case basis how they do it and what effect they want to achieve through that. So you can consult your dentist, or if you do not have one, please feel free to call our helpline, which will be mentioned in the description box below. We would be able to help you guide through the process and also connect you to one of our partner dentists closest to your location if you are in Pune. So, okay, next question is, how many times do I have to get scaling done? Yeah, scaling is a pretty common and easy procedure. It helps to get a good smile, good teeth, brighter looking teeth and healthy gums. You can go for, dentists recommend to go for one scaling procedure once a year. That should be sufficient. If you have extremely yellow teeth or some sort of internal issue causing it, such as smoking, please try to get rid of smoking habit as soon as possible. After that, you can go for scaling procedure for brighter looking teeth. In some cases, if you have really yellow teeth, the dentist could recommend you to go for 2 treatments in a month, in a year or so, depending on what your case is. He'll be able to guide you through. Does that drilling hurt? Yeah, okay. This is the same person who asked, can I get tooth diamond done? Does that drilling hurt? No, the drilling does not hurt. It is same as any other dental procedure in which you'd go for a cavity restoration or something. The same drill is used. The drilling does not hurt because they just drill it superficially. They do not drill it deep. They just drill it enough to put a diamond in it, and even only when it is required in your case. Sometimes dentists do not drill at all, they just stick it on. It depends on your case, and it depends on what the dentist has in plan for teeth. So yeah, but the drilling does not hurt. How safe is teeth whitening? Yeah, I get this question quite commonly. How safe is teeth whitening? It is a very safe and a relatively painful procedure. So, if you are having yellow teeth because of any problem such as smoking or tobacco or anything like that, that is why you have stains. Please try to quit your smoking and tobacco habit. If you need help, do feel free to call our helpline. We have specialist dentists on board who specialize in quit smoking and quit tobacco therapies as well. We would be able to connect you to them relatively easily. So consult us. And when you are successfully able to quit that habit, you can go for teeth whitening. It is very safe, relatively like very less painful, not painful at all for normal gums. It will help you achieve that brighter, shiny, white looking smile that you are aiming for this Diwali. Okay, so we have a few more questions. Let me just quickly go through them. I feel my teeth have become more sensitive after cleaning. Is it normal? You could feel that your teeth have become more sensitive after cleaning. This is because when the dentist is cleaning, he's taking out all the gum, all the plaque and debris deposited between the gums and your teeth as well. So you could feel sensitivity after for 24 hours or 48 hours, but that goes away after that. So that is good. When you have a plaque layer deposited on your teeth, you may not feel or the temperature or other things just as much. Now that your teeth are clean, you're feeling it more. That could be due to reason. But if you are still feeling sensitivity, severe sensitivity after 48 hours of scaling, do consult your dentist. He will be able to recommend good anti-sensitivity toothpaste and procedures to help you tackle that. Okay, so how long that diamond lasts and what is the cost? The diamond can easily last for about 8 months to 1 year, depending on your oral hygiene index, how you take care of your teeth, your oral hygiene levels, as well as the conditions in which the diamond is. If you accidentally get into a trauma or something, the teeth may fall off, you could easily bite it off or something like that. That is another reason, but normally it easily lasts up to 8 months to up till a whole year or even more in some cases. So it depends on case to case basis. What is the cost? These all come into facial aesthetics and are relatively costly procedures. It also depends on what kind of stone or diamond you are going for. If it is a real diamond or a real ruby or something like that. So taking into the cost of the actual stone itself and the procedure can get relatively costly. If you want details on that, please call our helpline and we will be able to guide you through on the cost and everything depending on which dentist you consult. How long does teeth whitening last? Do you have to get it done continuously? As I said before, teeth whitening, one treatment easily would last you up to 1 year, very easily. If you are not a smoker or a tobacco chewer or something like that, if you have any addiction or habit of smoking or chewing tobacco, teeth whitening would definitely not work in that case. You need to quit your habit first. But if you are a normal person who doesn't chew tobacco, doesn't smoke or anything like that, teeth whitening would easily last you for up to 1 year. If you you have the tendency of getting severely yellow teeth for some reasons, if you are a coffee drinker or something like that, you may need to go for treatments twice a year, but your dentist would be able to guide you better after assessing your oral cavity. So that's all for today. Thank you everybody for patiently listening to me for 30 minutes straight. I hope you gained some suitable and valuable knowledge from this webinar. Please feel free to share this video amongst all your friends or relatives during this Diwali season, whoever may need it or want it, for them to get help from it as much as possible. Please give it a like if you found it helpful. And don't forget to subscribe to DentalDost channel and hit that notification bell for all upcoming dental related videos. We would be having a webinar every Saturday on all the hot topics of dentistry, or all your queries would be answered in these. So don't forget to hit that notification bell. Thank you for staying till here all throughout. It was lovely talking to you, and hope you have a nice day. Bye-bye. Thank you.